So I wanted to ask you a little bit about the cohort's approach to testing and validating the P2P solution, and then really what lessons you kind of drew from or best practices from, planning for infrastructure and testing for a solution like this.
Absolutely, yes. Establishing seamless connectivity between payers, it demands adherence to specific infrastructure requirements and the implementation of standardized processes. It was something we certainly had top of mind throughout this whole process. So, to ensure those smooth operations and effective data exchange testing, we required cohort members to meet a few prerequisites. So, first was having a QI environment. So, payers and other participating entities had to possess the necessary capabilities within their own quality assurance environments. That allowed testing grounds, so to speak. And so these environments needed to include the implementation of the PDEX, the 2.0 version of peer-to-peer API. We required that there be configuration of the peer-to-peer API to respond with test data in the FHIR format. We required ability to send a request for a patient data to the Connectivity Hub's API server, and then we also required the ability to respond to a request from the Connectivity Hub. And really, what this enabled too was a common foundational starting point for all of our health plans to engage with our peer-to-peer hub. Second was a production environment. So, you have the QA environment to do all of the testing. And then, once you get through all of that testing, a live production environment. And so prior to executing an agreement with our participating payers, they were required to make their peer-to-peer APIs available in production environments to Availity. So these requirements ensure that the infrastructure is ready and that there are standardized processes for successful connectivity and data exchange within the cohort. And then the last piece was ensuring the reliability and interoperability and security of our connectivity solution. That is paramount to us. And so that's why we actually developed a mock payer service that provides a simulated environment for cohort members to test and verify their system's capabilities to send and receive simulated data end to end. So this service is designed to mimic the behavior of a real health plan. It allows users to conduct thorough testing of their systems under controlled conditions, and is a great way too before a payer starts engaging with another payer with real data that they have the opportunity to engage with that mock service.